Hello friends, welcome to medeasy. Welcome you to another video on medeasy. This video is about tumor markers. So what are tumor markers? Tumor markers, also known as the tumor index substances. They are the factors that are released from tumor cells produced in our body. They can be detected in blood and therefore the detection of a tumor in the body. So they are useful for the following purposes. First one is to monitor the effectiveness of the therapy and also to detect the recurrence of the tumor. Second one, the presence of tumor markers suggests the diagnosis and it also helps in for the prognosis. So serum level of the marker may indicate roughly the tumor load, which in turn indicates the disease is curable or not. Now those were the things about tumor markers. Now let's move to the precautions. Tumor markers are sometimes elevated in non-malignant conditions also. So it should be noted whether the person has for cancer screening or diagnosis and a positive test by using imaging studies and tissue biopsies. Now let's move to the clinically important tumor markers. Alpha-fetoprotein. Alpha-fetoprotein was first demonstrated by Abelev. Abelev was the first to demonstrate it as a tumor marker. So it is increased in the circulation of patients with hepatocellular carcinoma. That is, it is related to kidney and the kidney cells. So hepatocellular carcinoma. And it also increased in pregnancy with fetal malformations of neural tube. There will be neural tube malformations in fetus. The normal value is less than 15 nanogram per liter. It's a nanogram. So if it's above 300 nanogram per liter, then it is associated with cancer. Levels above 1000 are exactly cancer, and except in pregnancy, this is the non-malignant condition. You should be careful about carcinoembryonic antigen. It is markedly increased in colorectal cancers. Heavy smokers, about 5% of healthy persons have elevated plasma levels of CEA. It's a short form of CEA, carcinoembryonic antigen. Now let's move to beta HCG or beta chain of chorionic gonadotrophin. It is normally synthesized by normal syncytial trophoblasts, that is the cells of placenta villi. HCG is a glycoprotein. It has alpha and beta subunits. Alpha subunit is identical to FSH, TSH and LH. Whereas the beta subunit is specific for only HCG. This is the important point. So it is increased in the hyoidiform mole and choriocarcinoma and germ cell tumors. Now let's see the graph. After treatment, the level is decreased, but it goes up when the disease recurs. This is the monitoring of serum level in chorionic carcinoma. About 60% of the testicular cancers secrete HCG. A normal value is less than 20 IU per L for males and non-pregnant females. A value of greater than 100,000 IU per L indicates trophoblastic tumor. The next is cancer antigen 125. Cancer antigen 125 is a tumor marker for ovarian cancers. It is also a glycoprotein with the highest molecular weight and it's the biggest molecule identified. It is originally termed OC125 and hence the name CA125. OC denotes the ovarian cancer. Approximately 75% people with ovarian cancer will have elevated serum levels and they relate with tumor mass. Prostate specific antigen. Prostate specific antigen was first isolated in 1980. It was produced by the secretory epithelium of prostate gland. So it's named like prostate specific antigen. Though it's normally secreted into seminal fluid where it will be in the liquefaction of seminal coagulum. It's especially the complex to form is increased in prostate cancers. They have been found to be elevated in 60 to 70% with cancer of the prostate. Normal blood level of total PSA is greater than 4 nanogram per liter. Most of the PSA is complex to anti-chymotrypsin, that is PSA ACT. The free PSA can be separately measured. The ratio between two is a better index of carcinoma prostate. Free PSA is inversely related to probability of the cancer. Next, estrogen receptor. Estrogen receptor is a protein found in nucleus of the breast and uterine tissues. The level of the ER in tissue is used to determine whether a person with breast cancer is likely to respond to a therapy with tamoxifen. Tamoxifen is a receptor which binds to the receptor blocking the action of the estrogen. Women with negative ER have a great risk of recurrence than women who have ER positive. Progesterone receptor. Progesterone receptor is located in the nuclei of breast and uterine tissues. It has same prognostic value as ER. HER2/neu. HER2/neu is a protein that stimulates breast cancers to grow. So HER2 test is positive in about 1 in 5 breast cancers. These cancers tend to grow more aggressively than other breast cancers. Thank you, and if you like the video, please like, comment, share and subscribe.